Hello everyone, my name is Decontaminants. I'm doing a PhD on skin decontamination at the University of Hertfordshire in the UK. I'd like to welcome you all to this poster presentation about improved assessment of skin decontaminants, the development and validation of a robotic system for the accurate and reproducible dermal application of candidate products. When we look at our skin, it might not be obvious how challenging it can be to effectively decontaminate skin following a chemical exposure. The skin is a very complex, very uneven structure with hair follicles that make the complete removal of chemicals extremely difficult. So the application technique of decontaminants may affect the effectiveness of decontamination. Certain techniques might be better than others. So far, there are only few studies that have looked into this, and even these studies relied on manual application of decontamination products. So if you would imagine you're given a decontamination product, such as a wipe, and asked to decontaminate yourself, do you think you would do it exactly the same way as I would do, for example? Probably not, right? Manual application inevitably leads to many variabilities. The time we spend decontaminating, the pressure we might apply, or the consistency of the technique can be totally different. So the purpose of this study was to establish a reproducible methodology to test different decontamination techniques in an in vitro setup. Therefore, a robotic system was purchased and programmed to do 5 different decontamination motions, which were blotting, side-to-side wiping, circular wiping, and a combination of blotting and side-to-side wiping, or blotting and circular wiping. Then the time taken for performing each of these motions was determined, and the area that was covered by the robot was also measured by applying a dye to the end effector piece of the robot and performing the motions on a piece of skin. Later, the skin was imaged and the images were analyzed. Last but not least, the pressure applied by the robot was also recorded. Now, coming to the results. The robot was successfully programmed to do all 5 decontamination motions on a piece of skin that was mounted in a diffusion cell. Then the decontamination duration was set to 5 seconds for the individual motions and 10 seconds for the combined motions, and it was determined that 5 repeats of blotting and side-to-side wiping, but only 3 repeats of circular wiping were possible in that given time. The area that was covered by the robot was measured as a percentage of the total area that was available. Figure 2 shows representative images, so the black area is the area that was covered by the robot. Blotting resulted in 36% coverage, side-to-side wiping in 56% and circular wiping in 70%. So when we look at the combined motions, the blotting and side-to-side wiping was similar to side-to-side wiping alone, and blotting and circular wiping was similar to circular wiping alone. Finally, the pressure was determined to be between 0.7 and 0.75 psi, which was within the acceptable range. Normally in contact transfer studies, a pressure between 0.7 and 1 psi is used. So all this leads to a successful validation, and in conclusion, the study has established a reproducible method for assessing decontamination techniques and decontamination efficacy of a range of products. In future, the system will be used to determine optimal application techniques of products following exposure to chemical warfare agent and similants. It can also be extended to other dermal in vitro studies as well. So with that, I'm coming to an end. If you have any questions, please let me know. And thank you for listening.